Hello everyone, welcome to TradeFlock. Myself Vipin Kumar, and today the guest we have in conversation is someone who strongly believes in the power of mentorship, who is blessed to work with the great number of mentors, who has impacted his life at every phase of his professional journey, and he himself has mentored many people and touched many lives. This guest has contributed enormously by improving quality of life and providing the best care for patients. We are talking about Adam J. Sagot, who is the Chief Medical Officer and President-elect of the American Society of Adolescent Psychiatrists. Let's explore the world of medicine and its daily challenges with Mr. Adam. Hello, Mr. Adam. So, Mr. Adam, to start this conversation, I would request you to quickly walk me through your overall journey. How has this journey been so far? What were the key milestones and achievements you still cherish today?
That's a great question. I have been the benefactor of much stewardship and mentorship in my career, and without those individuals, I wouldn't be where I am today. It started in medical school with our department chair of psychiatry. He opened the doors to the rest of the world that was out there for me and teaching and academics, and then other mentors that allowed me to pursue my own interests, investing their time in me, their sponsorship in me to attend conferences nationally. And it's really been a good journey, and I'm very grateful for all those who have helped. But this is a mission, and the mission is to impact the systems of care we work in to increase access to care for patients. And the mentors along the way have really opened these doors so that I can be here today to try to do just that.
So, in this conversation, you have emphasized a lot on mentorship, how mentors have impacted and improved your leadership at various phases. So, but obviously there would have been some challenges in this journey. So, can you please discuss that?
Child and adolescent psychiatrist myself, we're not short of challenges on our journeys. We often encounter patients and families who've never encountered mental illness, let alone the treatments or the cultural or medical awareness on how to approach it. That's always a barrier. But ultimately, some of the biggest barriers I have faced have been in terms of taking risks, trying to overcome challenges within our healthcare system, trying to advocate for our patients, for public policy change, so that the systems of care that they all receive their services from can be improved. There are many issues in psychiatry specifically. We look at prior authorization reform and scope of practice rules to make sure our patients have safe access to quality and well-trained care. We work on all of these barriers because there are many forces out there that want to remove protections from patients and make it harder for patients to receive the services that they do, to ensure other financial models maintain their profitability. And individuals like me will no longer stand idly by to these challenges, and will use our skills to do better in these spaces. And my mentors helped me cultivate skills in advocacy as a physician. And it's certainly an area of passion of mine, and one that I'm very proud to take part in regularly.
So, in the course of dealing with these challenges, what were some of the golden lessons that you had from these while dealing with these challenges? And can you please recall any specific patient story from your early clinical days that still pops up to your mind during board meetings or whenever you are busy? And how did it impacted your leadership further?
Healthcare is a bipartisan issue. Everyone has family, friends, acquaintances, neighbors, colleagues that are affected. 1 out of 5 individuals in the United States are affected by mental illness. Similarly, across the world, epidemiology data is rather similar. So we know it affects someone we know, someone we care about. So let's all come to the table, join together, work forward, work together, and move policy forward that improves patient care systems, that's patient-facing, patient-centered, to improve quality outcomes. And I believe that that is the golden rule that I have found. And light, to use your term, or golden rule that became apparent during the pandemic was just that mental health and mental illness, sadly or fortunately, received some limelight and much needed attention to a problem that was overwhelming already, a problem that was already present pre-pandemic. But what it did was it shone a light on this individual group of populations that experience mental illness, and allowed bipartisanship to really rise to the occasion rather, and really move some mental health policy forward in the last 5 to 7 years. despite political climates now, we stay steadfast in our efforts to move policy forward still today.
Physicians burnout is a major concern, not just across United States, but all over the world. So, what is the simplest thing or the strategy you do every month to make sure no one burns out on your
It's a
watch?
great question, actually, because it's something I do in my personal life. It involves a lot of information about self-care, about mindfulness practices, and positive thinking. At the end of the day, we leverage our workforce as best we can, whether they're physicians or mid-levels, to ensure that patients receive the best trained care to have the best outcome at all times. And we try to triage the more complicated cases to our more experienced and more well-trained staff so that we can leverage everyone's time appropriately. But to answer your question, as psychiatrists and mental health providers, we are the first and front line for individuals to learn how to manage these issues in their own lives. So we try to apply these in our own lives as professionals. And of course, just like the patients we treat, we are humans. We are not perfect. We make mistakes. We are not necessarily expert at applying these skills in our own lives as much as we are teaching others to apply them in theirs. That said, it is certainly something I value. Meditation is a powerful practice. I recently authored a piece that is undergoing editing now for publishing about meditation and treatment-resistant depression. I'm also in the process of writing a self-help book on positive thinking and the ways it can be used personally and professionally to enhance your experience of life and to live happier. I believe all of these things have the same theme, which is self-care. And how we define that is, of course, subjective. But ultimately, I'm talking about the other variables in the equation to getting better that don't involve a therapist or a psychiatrist like me to prescribe medications. Eating right, going to the gym, good sleep habits, good interpersonal relationships. We have a great study on happiness that Harvard produced looking at decades and decades of data. And what we learned was the quality of our relationships dictates our happiness. So I try to live by those understandings in my personal and professional life. I try to provide a rich, substantive relationship for the staff that works under me in my company, for the other individuals that I get a chance to work with clinically, the patients and families. I try to give them the same respect, courtesy, and substantive intimacy, professionally speaking, as it relates to our relationships, so that they can feel that same experience with the care that they receive, with the supervision they receive, with the leadership I provide.
Telemedicine is fully mature now and has rolled out all across the world and touching significantly, specifically, the rural part of the world. So, what is one quirky feedback, or it might be good or funny, that you received from a patient that made you rethink how you roll out virtual
That's
care?
actually a very thoughtful question. There are many things that come to mind. Telehealth has been a great leveler for individuals that have less resources. However, there are assumptions built into that they have adequate access to technology and Wi-Fi communication services that we don't want to take for granted. We could always use more grant funding to ensure those in underserved and rural areas have adequate access to telehealth because it is the great leveler. But what it did do was it provided new information to us in the professional field. Normally, I have a patient come in, they had to take time out of their day, so there was a larger commitment and investment in their treatment, and certainly certain patients might require that and be best suited by in-person care moving forward. But we now have years and years of data of patients who have exclusively been treated with telehealth. So we know that the new standard of care has been created, and that's certainly safe and equally efficacious for patients, meaning that they have the same outcomes, which is important. But we get more information. It's really interesting. I get to zoom into a patient's home or to Teams into a home or to use whatever telehealth modality I have. And I get so much more information. I hear the family discord in the background. I hear the dog. I hear the brother or sister in the background vying for their family's attention. I see the person constrained, trying to find limited physical private space in their own personal life. I see how they keep their rooms, their spaces. I get all of this other information I might not otherwise have. So it is an abundance of riches from a clinical perspective, similar to home medicine, like it used to be, where we used to do house calls. It's now an opportunity to do both, and hybrid is the way of the future. Offering both to patients is where we all need to be. I have zoomed into patients who had the business attire of professional up top and unprofessional on the bottom. I've had patients zooming from beds, from bathrooms, from showers, from all places you can imagine. And ultimately, we relocate to something more appropriate. But of course, the funny things have happened. That said, it has highlighted the value of this tool. And it's one that's here to stay, and you should accommodate your patient's ask in person or telehealth. The challenge, though, is of course licensure. The provider has to have a license in the state the patient resides. And for physicians, this is very challenging. Every state has their own licensing board. We need more work on interstate compacts so physicians and mid-levels and others that work in the medical field can work across state lines, imagining that they have the same professional requirements in those states that they were originally licensed, that the other states do, and giving them the professional courtesy of continuing to see those patients, to serve patients everywhere, to be that great leveler. But right now, there are a few barriers, but I believe we can overcome them.
When you started this journey, what was the goal or pursuit that you were chasing? And do you think you have achieved it now?
I don't believe I have achieved it yet. I have achieved it to some extent. Um, Over time, I've already shared with you the value of mentorship, and one of my mentors taught me something I believe I might have shared previously. But ultimately, the more people you can educate and work with clinically, the more people you can impact, the more patients you see, the more people you can impact, the more lives you affect. From the educator, though, you impact all the lives that they treat as well. So my goal has always been impact factor and improving access to care. In my roles in the last 4 to 5 years as a training director, as the chief medical officer of an inpatient site, now as an outpatient system nonprofit CMO, my mission has been one to find reasons to provide care to more people at all times, to open our doors further, to open our reach farther, to make sure that we can find as many opportunities and as few barriers to keeping our doors open and available to patients as often and as late as they need in the day, as best we can accommodate the high level services that we provide. And I do believe I've accomplished that to some extent. I believe that I've been able to increase impact factor in a number of sites at the hospital and health systems I've worked for. And then lastly, the other thing I do think I have achieved is the reason I became a child psychiatrist, which is to help people, especially early in their life, that have so much potential to get better. The propensity of their life has yet to be written. They have so much opportunity to do extraordinary things with a little bit of guidance. They don't have an emotional vocabulary yet. I get to have that journey with them, and it's a collaborative adventure forming language together. I can help them better adjust to a bad situation. I can help parents improve their skills so that they can manage their children more effectively, more appropriately, so that they can securely launch them out of the home when it's time. And ideally, child and adolescent or any pediatric medical specialty at its core is preventative medicine. We get to prevent the bad things that happen in adulthood if we do enough of our role, if we provide enough service early on in life. So we can prevent all of those problems later in life if they can meet a child adolescent psychiatrist, a pediatric subspecialist, a mental health provider that specializes in children early on. Because the earlier you start treatment, the lesser the illness burden later in life across the board. So if we can meet more people at a younger age, the better we can serve our patients, our community, and each other. And though in that way, I do believe I have had some degree of success already as a provider, but the job is not finished.
What is one big challenge or change in mental health that you are secretly betting your career on? And how are you quietly planting the seed of it today?
Well, I would certainly say that I, among many, are planting our seeds and betting heavily on the role of artificial intelligence in medicine. Every aspect of clinical care will be impacted by this functionality. Its integration into our electronic health record, its ability to scribe, suggest diagnoses, treatment algorithms, all of this is going to be refined over the next 5 years at an exponential rate comparatively to the past. We know this, we've seen these technological trends as it relates to other tech, other historical events. We know it's coming and we know it's going to be assistive. I'm concerned, of course, about the challenges it represents, the barriers we can't quite put our fingers on, the unchecked reality of AI in the community. Working in therapy spaces is certainly one I'm wary of. I certainly want to be mindful that a therapy bot is not a therapist. But at the end of the day, there are ways to leverage our workforce such that an AI conversation might absolutely share the level of care and service need faster than a human might be able to and connect them to the right person on the back end thereafter. There are ways to leverage these opportunities. And I do believe that I, among others, are betting very heavily that AI in the next 5 years will radically change the way healthcare is delivered. in mental health and elsewhere.
So, Mr. Adam, that would be it from my end, and I must appreciate your outlook on life, how you see and how you prioritize the patient care, regardless of anything. It was such a pleasure speaking with you. We look forward to future associations. Thank you.